Hi, everybody. Welcome to AI Live. Our team always surprises us and turns the cameras on early. Good evening. Thanks for joining us.
Thanks for joining us here at AI Live.
I know. We have some fun stuff that we are going to talk about tonight. It'll be kind of fun.
Yeah, microneedling.
The good, bad, the ugly, the whatever.
I've actually gone back to it. You know, we have all these fun advanced things, and you know, basics are basics at the end of the day, and they work really nice. But before we jump into it, what are we talking about?
We have stuff.
What are we catching up on? What have we been up to?
Gosh, what's been happening? Oh gosh, I'm finally home and not flying for a couple weeks.
A couple?
Yeah, within like 2 weeks, I was Vegas, flew to Florida, came back, flew to Chicago, came back, flew to Chicago, flew to Kansas City, came back, and now I'm here.
Houston.
Oh, and Houston, and then came back. So yeah, it's been crazy.
It's been fun. You've been traveling. I haven't.
Yeah.
Not too much. Not too much. We'll see. The rest of the year may change for us, right? Oh.
It's kind of crazy.
My cell phone.
It's fun though.
It's fun. I gotta go to Taiwan. I signed up. I'm gonna speak now.
At what conference or what?
AMWC for Taiwan.
Nice,
I
nice.
Get to visit my niece and nephew.
Oh, that'll be fun.
And present.
That'll be fun.
So it should be fun.
Good.
It should be fun. All right. So we're gonna jump into our topic for tonight, which is microneedling.
Yeah.
The good, the bad, the ugly. You know, I think microneedling's been around for a long time.
It has.
Right. I don't think people talk about it enough sometimes. I think people generalize it. They overdo it sometimes, not needing to go so heavy. So hopefully we'll get some, ask your questions with regards to microneedling. You can take it into microneedling RF if you guys have questions with regards to that. But this is for you guys to get interactive. This is us kind of throwing different ideas out there to talk about. But different types of microneedling.
Yeah.
Right.
And keep in mind, we have a chat, we have a screen here that we can see with your questions. So feel free to type in questions and make it interactive because we want to hear from you guys.
Yep. So derma rolling.
Yeah.
You hear this a lot. This is early on, probably like 10 years ago, if not more, right?
Yeah.
Where we started hearing about derma rolling and people taking these rollers and rolling. And back then, we were going to conferences and we were like, ew. And, it's ventured into this more mechanical microneedling, which is more of those pens that we're now using that you see out there. And then, of course, the advent of the newer technologies, which is taking the microneedling, combining it with the radio frequency, and taking it to that next level and having microneedling RF. So what are your opinions on these?
The derma rolling worries me because usually those are done at home. And I'm not sure how people are sterilizing the needles on that little roller. So, you're going to have debris and skin and blood, and you're going to have stuff on there. And bacteria is a beautiful environment for bacteria to grow. So I worry about that and how someone's going to clean that. So we know that when we use microneedling, we're using a sterile new device. So we're using a tip that's sterile. So we know that that's clean.
And sharp.
And very sharp. So I worry about the derma roller stuff at home.
Yeah, and you guys have to think, when you're derma rolling, these needles have to actually get into the skin. So they're rolling into the skin and rolling out of the skin, which is probably not as nice as just going straight up and down into the skin. You're actually kind of ripping in and ripping out. And so, I definitely think the derma rollers, you have to be a lot more careful about utilization into that aspect of it. I don't think people microscopically really think of it, but you have to be a lot more careful with derma rolling and not go too aggressive with regards to that.
I agree.
Mechanical microneedling, I think, is good. Vera has a good question. Can microneedling cause scarring if the setting is too deep or lines underneath the eyes?
You can cause. I'm going to talk a little bit later about one of my patients who had issues, had problems with somebody who didn't know what they were doing. But I think you can cause scarring. I think you can really do some damage if you overdo it.
Yep.
Yeah.
And then microneedling RF, love.
Let me mention one quick thing. I'm sorry about the mechanical microneedling. Make sure if you buy a device that it has an active extrusion and an active removal of the needle,
Yep.
like extrusion and rebound,
Push and pull.
push and pull.
Push
That
and
it's not
pulls.
just kind of spring
and
loaded.
rebounds.
You want it to be the push and pull. Some of the ones that are kind of like spring loaded, the little needles don't come back quick enough, and when you go across the skin, it'll drag across the skin. So make sure that you have a very active push and pull on that needle in the device head itself. We use Skin Pen. We found to be probably the best one we found so far, and we've used quite a few different ones.
Yep. Dermapen, I think.
Which drug across a little
The
bit.
newer one has improved. They have a Dermapen 4.
Ah.
Yeah, they have a Dermapen 4.
Well, I got rid of my
Yeah.
1 or 2 or 3, whatever I got rid of.
I think ours was 2.
Yeah.
All right. So derma rolling overview mechanism: device rolled or stamped. I think the device rolled, as I said, be careful of that. The whole goal is to increase permeability. There are devices like Aqua Gold. I think Aqua Gold is nice. Little holes in the needles that allow you to get superficially products into the skin. I just stopped doing Aqua Gold so much because the products cost a lot.
And the little
I think from a business
bottle's
side of it,
$100.
The little bottles, if you bought a bunch, you had to buy a bunch of them to get it down to $100,
Is
$120.
really
I
expensive.
remember.
Yeah.
And so ultimately you end up with $100 for the actual Aqua Gold itself. Then by the time you add all the serums and your toxins, and if you add a little filler into it,
It's a
it
$500
can get like
bottle.
$400, $500 bottle, and you have to take the time now to stamp them. And the problem is that these treatments probably lasted about a month-ish, and so to charge them $800-$900 for something like this seemed a little.
It didn't last.
I'd rather them do, I guess, things that I think were more effective to really make bigger changes onto the
more
patient.
bang for their buck.
More bang for the buck
Yeah,
in the long run.
I agree.
So that's kind of derma rolling in a sense. So the good, low cost, minimally invasive, of course. The bad, high risk of allergic reactions, granulomas, more infection, inflammations. I think you're ripping the skin more so than regular, real microneedling that we're doing at our clinics. And then the ugly, more and more people are swerving clinic fees and buying cheap derma rollers, and the ones that go very deep can lead to scarring.
Yeah, for
scarring
sure.
and infections.
Absolutely, because they're not sterile. They're
Yep.
sticking them in their drawer and then doing it the next day. So you can have a lot of superficial skin infections with this.
Yeah. Mechanical microneedling?
Yeah, this is usually motorized. It can be either battery or plug-in. And these little needles, there can be 12 to 20 little needles in each little head, and they're usually very, very tiny. They can create very, very small little channels, which we know that whenever we create a little damage to tissue, it's going to always cause some remodeling, and that's going to help with hyaluronic acid and collagen and elastin. Some of the devices are Skin Pen, MD Pen, Skin Stylus. There's quite a few different brands out there.
Dermalogica's coming out with their
Really?
medical
Nice.
esthetician version
Nice.
of it for those estheticians in some of the states that are allowed to do some microneedling.
Yeah, some states they can't break the skin, some states they can, so check your laws. And generally, when I do a microneedling package, I generally sell a package of 5.
Yep. Agreed.
I would say don't sell somebody 1 or 2 because they're not going to see much of a difference. And I had a talk today with a patient, and I said, you are not going to see a big difference after 1 treatment. It's going to take a few, because all we are doing is making holes in your skin, and we're sitting back and we're cheering your collagen to grow. We're not controlling that.
Yep.
It's not rocket science. We're just making a bunch of holes, and we're counting on that body to regenerate, and that takes a few weeks. So you can't really speed this up too much.
No, you have to spend time explaining it. I think anything we do with skin takes time for explanation. It's not as easy as toxin. It's not as easy as filler, because you see these immediate quick effects. Even toxins, you need a little bit of explanation. Like that line that's been there for 10 years is not going to go away with 1 usage of toxin.
Sometimes they listen, sometimes
Majority
they
of the time they don't, because everybody waits until the last minute to do anything, and then they want you to wave their magic wand and say poof, and then they want to pay the least amount. I mean, my whole thing, I always go to analogy, is I always say, well, you kind of waited till the smoke came out of your car before you started to see me. So you know that you're probably going to be spending a little bit more time here, and you're going to be spending a lot more money here, because you ignored all the signs that were telling you were aging. Because majority of our patients always say, I just, it was just last week I stared at myself and I just fell. I'm like, no, majority of people are like, I'm looking okay, I'm looking okay, I'm looking okay, I'm looking okay, until the one day they look in the mirror and the shadow hits them and there's wrong light and they freak out.
It's the rearview mirror.
And it's a sad part. It's kind of like your car was blinking the little check engine light, go get your servicing, and they completely ignored it. And then they finally wake up when smoke finally comes out and they're like, okay, well, I have $100 to work on what I need to get changed. Well, if they had spent that earlier on to do multiple treatments, where this one for sure, like microneedlings, require a series of treatments, and it's not going to give you this magic wow. It's slowing down the aging process, and hopefully you're starting to do a little bit and catch up with some of that, a little bit of reversing. But ultimately, we're all aging. I can only do so much. I can't reverse time and age. I can slow it down. And that's where our job is to do. And so hopefully the education that you guys are doing is really talking to the patient about starting a little bit earlier. It doesn't need to be a ton. They don't need to do, maybe if they're in their later 20s, they don't need to do this every month like a person who has a lot of issues. They can get it done once every 3 to 6 months, and they're slowing their process down because they have a lot more power of collagen stimulation that they can utilize.
Yeah.
So the talk needs to be a little bit earlier, and the talk needs to be, this is going to require a bunch of treatments. It's an investment in you. Okay.
And generally, historically speaking, as far as research, when you do about 5 sessions 1 month apart, about that 6th month, if you have acne scars, you're going to get about a 30% filling in of that acne scar. So this is a great treatment for acne scars. It really, really helps that kind of fill in. You're kind of damaging the old scar tissue and building new, damaging the old, building new. So you'll just, so you have a kind of an idea, it's about a 30% filling in of that depth of that scar tissue.
And the depth does, does, I think, change depending on what you're trying to do for your patients, right? I mean, ultimately, I think I see all over Instagram, people are doing it all the time to the point that they're bloody every single time. And I'm like, do you really need to get that bloody? I think in my books, I don't need to get my patients that bloody. I don't even need to get my patients bloody. A lot of you guys are using like PRPs and all these nice, beautiful serums when you're doing these microneedlings. Well, think about what you guys are doing. Yes, you're stimulating collagen by the needle going in and out, in and out, in and out. But when blood is seeping out of all of these pores, that beautiful serum that you just charged them $500-$600 for is not entering into the skin whatsoever. Essentially, you're wiping it all off. So think about that when you are charging your patients an extra $500 to $600 on top of microneedling to do a vampire facial, when you're really not doing anything, in my book.
Yeah, you've got blood blocking all those microchannels, so you can't get the PRP or exosomes in.
Yep. So ultimately, think about what you're trying to do. If you're trying to get stuff into the skin, you need to make enough channels and keep them open, which means you can do it at a smaller depth. You can do it at 0.5 millimeter, 0.75 millimeters. As long as they're not bleeding, you should be able to get product into the skin because you've created these channels. But if you are going into the 1.0, 1.5, 2.0, 2.5 millimeter depths, there is a purpose for that when you're working for acne scars and all those things. I think it's beautiful for that. But if you guys are doing things where you're like just doing it just because everybody else is doing it on the block without actually critically thinking why you're doing something, you're missing the ball. You're not doing your patients any service except just charging them for wasting product.
Yeah. And Jasmine has a question regarding acne scars or if you're microneedling on active acne. I don't like microneedling on active acne. If there's a couple little comedomas, I might be okay, but I don't want to transfer that bacteria to the rest of the face. So kind of get that calmed down first, whatever mechanism you need. If you need to throw them on some antibiotics, if you need to throw them on something to kind of calm down, whatever it might be, calm down the new breakouts and let those kind of settle for a little bit and then work on it. You just don't want to exacerbate
Yep.
that and cause any active infections that they don't have. Yeah, good question.
Guys, go back down on that. Was it Kathy had a microneedling following by injection of PRP, topical exosomes. Injection PRP, it's going to be up to you. I mean, if you're injecting it, a little bit different, but ultimately, if I were to inject PRP, I would do it at a different time frame sometimes. You are injecting it, you can inject it deeper into certain areas. I think it's fine.
Keep in mind, it's not a filler. PRP is not going to give you volume no matter what.
That's another topic. People doing it underneath the eyes and saying it's filling, even with this PRF gel and stuff like that. Please don't fall into the trap of what they're selling you. I mean, yes, it'll thicken up your skin. Yes, it can look better, but that's because your skin is healthier and thicker, not because it's filling it. So you guys need to go back to understanding the science when you are doing something. Don't just jump into things just because somebody else said it does this, it does this. Really, really go and do your research. Educate yourself on why you're doing these treatments for your patients.
Yeah, and keep in mind that PRP is very pro-inflammatory and exosomes are very anti-inflammatory or de-inflammatory. So you're going to see two different results after the treatment. You're going to see more swelling with the PRP, but with the exosomes, you're going to see a lot of the swelling reduced, which is something we really do like a lot.
Yeah, and so I mean, does this make long-term meaningful differences? For sure. I know exosomes. You can do a lot more research. The one that we like to use, Benev one, I've seen some of the research from Korea. They're showing 300% increase in elastin production, 600% increase in collagen production. So yeah, if you're already traumatizing the collagen in the skin and you're trying to get your body to stimulate more collagen, why not put something that's going to mobilize it even better and faster? So, I mean, there are reasons for that. Not that PRP doesn't and can't do that. PRP can, but PRP also has an inflammatory response. So you have to think about, is the inflammatory response causing more not say harm, but delayment in the aspect of their growth factors causing stimulation into the area. So, I mean, I definitely think PRP overall does work beautifully, but that was 10 years ago, and I think that having moved on, I personally like the exosomes. I know there's a lot of controversies, injecting exosomes. That's going to be up to you guys and your comfortability. Malpractice sometimes is not going to cover it. You guys have to realize a lot of these things that are on the fringe that are continuing to advance. FDA is not going to approve a lot of these things just because nobody has the money and capability to go through FDA trials except for really, really big conglomerates that have money. And, there is a lot of good research about certain of these things, whether it's PRP, do a lot of PRP injections into joints and stuff like that, followed by exosomes, stem cells. There's a whole slew of things you can delve into out there that do make a huge, huge difference in the quality and the results that, in my opinion.
And I wanted to bring a little kick into that PRP thing is make sure that you have like a 5 to 6 time concentration. If you have a little 10 ml vial that you're drawing and then you're spinning that down, you're giving them a few mLs out of that 10 ml vial of PRP, you may as well just inject them or put their own blood on top of them because it is not concentrated enough to get the growth factors you need to do anything. So make sure that you draw that big 30 cc vial and you spin it down and you're taking 5 cc's out of that, and then you're going to have a lot more of the good PRP that will really actually have enough growth factors to do something. The second thing is you're only going to get the quality of PRP out of the quality of the blood. So if somebody is older or they're not healthy, you're not going to get great PRP. So just kind of know where that is. With some of the exosomes, it's very consistent.
Yep.
So some is even from umbilical cord. So it's very, very consistent.
Yeah. So, I mean, those are great, great points. You guys really need to jump into it and really understand a lot more about what you are really doing because everybody talks a lot out of there. PRF is just PRP. In a sense, it's a little bit more of a gel aspect of it. What you're using is the same product as what PRP is made of. PRF, PRP, PRF, PRFM, which is just the matrix. They're all kind of the same. Valerie, exosomes is not genetic material up to a certain point. You're not getting actual materials. There may be some little mRNA they do talk about in that aspect of it. but genetic material as it being like an actual stem cell itself is actually not what exosomes are. So exosomes are more cytokines, interleukins, they're more messaging, growth factors, all of that type of stuff into that area. So that is very, very different on the aspect of it when you really look into that. Mike, exosomes, FDA efficacy. FDA.
We just opened an exosome can of worms here.
That's what this is for. We'll probably do another talk on exosomes.
I think we'll need to.
There are a lot of exosomes out there. The brands that we use, I think we use Benev one just because I like the fact that they actually went through and all the exosomes out there for the most part. Are going to be two aspects of it. They're going to be a topical one, which means that they have some sort of clearance from FDA. They're not approved, but there's a clearance by FDA. So when you're using something topical, there's a different approval process than when you're actually injecting it into the body on that aspect of it. Majority of all the exosomes are not going to have any FDA approvals because it takes a lot of process and understanding with regards to it. You guys have to realize exosomes, because they're coming from the body, have a lot of paracrine effects that cause the issues of what we're doing, and you can't show that that exosome does the exact something, and thereby FDA doesn't really want to approve those type of treatments because there's no, like, you take this blood pressure medication, it does this and affects this. There's a cause and effect and the measurable effect. When you're doing exosomes or stem cells, there is not, and this is why there's going to be a huge, people will always, a lot of practitioners out there that don't understand how the FDA works are going to always stand by the, well, FDA doesn't approve it, FDA doesn't, well, if you wait for FDA to approve it, you're going to wait until the cows fly home. Then they're not, unfortunately. And so this is where that whole regenerative side is. You can say on the underground side, and it comes down to your comfortability. I'm not saying that you have to do it. I'm just saying that it comes down to your comfortability. I've been doing research onto it for the last 7-8 years. I've been doing it on myself for a while, as far as IVs and all that stuff, and I think they're completely safe to use. The Benev one, I think, has been safe to use. I have injected it into the hair. I've injected it underneath the eyes. I use it with my microneedlings. I use it RFs. Open wounds on CO2s. I think you get a lot more healing, a lot faster healing process with regards to that.
Time.
You just need to use enough. The hard part is what is enough to use. How much do we need of the exosomes? That is the standard that's still shifting because we really don't know, and everybody is different. Like, where is your inflammatory process? How much inflammation do you have? How much exosome do I need to put on to suppress your inflammatory response? And that's why some people get better response than others. But that's still in the air, and this is why it still is up in the air about the exosomes and stem cells when people are really talking about it. It still is hard to define and really understand. It's a belief. It's like buying crypto coins. There's a belief that it does work and it will be here to stay. And with the science behind it, there is a huge amount of science behind stem cells and exosomes that is out there. You just have to do it. It's in the medical world. But they are great with regards to that. So hopefully that's done a lot of answering on that aspect of it. Let's see, we can start answering some questions. Quicker results, RF microneedling versus regular microneedling. It really depends on what your goals are. So when do you define microneedling versus RF microneedling?
I think RF microneedling is, you're going to get more dermal thickening, you're going to get a little bit more tightening. With regular microneedling, when I have some scarring, when I have some acne issues, more textural changes, I need more treatments, more textural changes. I'm putting 3 million holes in that face when I do regular microneedling. Half an hour of doing microneedling is about 3 million holes with a skin pen. So you're getting a lot of little holes in there and creating a lot of new collagen growth and really doing a lot of regeneration. With the RF, you might have a little stamper that's got 25 pins, and you're just stamping maybe 500 stamps, so 500 times 25, whatever that is. So that's a lot less than 3 million.
I know.
So anyway, so you might end up having quite a bit of difference in that. So I think I want more of those holes for somebody that's got more of the acne, more of the textural changes I need. If I want something that's just more shrinking pores, tightening the skin a little bit, getting more dermal thickening, more collagen stimulation, I'll go to the RF. I love RF. I love adding the heat to it because we're gonna get more denaturing of that tissue of the collagen. We're gonna get more collagen building with that.
So to me, if you're in general looking at the overall goals of your patient, if there is a tightening component that is important, the micro RF is probably a little bit more in my wheelhouse. If it's more textural issues, more glowing of the skin, pore size, all of those things, you don't need to get as aggressive as a micro RF. That does hurt a lot more. Microneedling in and of itself does a beautiful job. I combine it on myself, like my skin. I use almost practically nothing on my skin. I don't even use sunscreen sometimes. But I'm a guy, I'm lazy. But when I do my lasers, I do laser. I do a Q switch, the Hollywood peel, if you guys follow me, and then I follow it up with an exosome and microneedling at like 0.5 millimeter, and this is kind of what I get. So I try to do it consistently every 3 to 4 weeks if I have the time and opportunity to do. But I definitely noticed after about 3 to 4 treatments using the microneedling after my laser with the exosomes, my skin definitely changed to the point where my patients are asking me, what's going on with your skin? How come it looks so good? And I was like, I didn't do anything different. I did add the microneedling, but I didn't think, in my opinion, I didn't think anything of it. And I only was trying it out on myself at 0.5 millimeter because it's like, is it going to make a change? But I didn't want to get bleeding on my skin because I didn't want to waste the exosomes that can get a little expensive. They, the topical ones from like Benev, I think they run somewhere about 150 to 200. I think if you're buying a package of them, they're not really that expensive. The fact that you just they leave them in the fridge, you pop them open and you mix it up and you inject it, or you put it topically. I don't have to draw blood. I don't have to worry about spinning it and dealing with all of that. I love that, on the aspect of it.
And question, can you do radiofrequency microneedling with melasma?
Depends on which machine you have.
With there's one device that will work with melasma, and that is the Silpherm.
Yep.
They've got it's the newest technology out there, and it's got the pulse wave technology, which breaks down the energy into small little pulses, which actually, and you're going a little more superficial, and you're not going as hot. But what you're doing is you're going in there and it's actually kind of remodeling that basement membrane so that those fibroblasts and melanocytes that kind of hang out in that dermal area, which gives you that shadow color. It's not the superficial epidermal pigment, that melasma that looks like you could pick it off. It's not that. It's that shadow that's deeper, that's really hard to get rid of. That's all sitting in the basement membrane. So if we can increase that integrity, we don't get all the melanocytes sitting in in that basement membrane and causing that shadow. So we've done it quite a bit on patients that have melasma and noticed an incredible difference. Did we want to? No. We really didn't want to put anything hot in tissue with melasma, but we've been very pleasantly surprised and happy with this technology because it works. So it's, Dr. Na's pretty smart.
No, I mean, it is an interesting thing with the microneedlings. I mean, and you really have to delve into the science behind the microneedle RFs. I know everyone talks about Morpheus. Ultimately, whether it's Morpheus, whether it's Potenza, whether it's other treatments, you have to realize a lot of it has to do with the way the needles are put in. It's a non-insulated needle that Silpherm uses versus the insulated needles that majority of the other companies are using. And when you're using insulated needles, you force all the energy into a tip. And when you force all the energy in the tip and you add it for a certain amount of time, you end up frying that layer instead of actually creating enough of a controlled damage. And so ultimately that ends up with the amount of heat that you could put in. If you have an insulated, you can actually make your melasma worse. Where Silpherm differs is the way the technology allows the energy of the radio frequency to penetrate in, that you're not actually creating a huge amount of heat. and a huge amount of damage and necrosis into the skin that could exacerbate melasma. And then, of course, Lori talks about the pulse wave, which actually breaks it up and allows that repair of of that basement membrane that allows those melanocytes to square back into the layer that they're supposed to be, and thereby actually treating melasma. Versus before, everything that we've been doing in previous times has actually been just treating the symptoms of melasma, versus what we're now able to do, which is treat melasma. You still have to clear up the skin with whether your chemical peels or other things. You know, somebody said tranexamic acid, beautiful. With microneedling, can do a very, very nice job. If that's all you have, tranexamic acid with your microneedling is beautiful on that aspect of it. So ultimately, I think that is really, 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 really important to understand, because microneedling RF is a heat. You guys have to realize it's heat. We started off with thermages, all of these radio frequency. It's about adding heat to it. And if you can't control the amount of heat into a tissue, you're going to make melasma worse. That's why we don't do IPLs on melasma. Unless it really is, you understand it's an epidermal melasma versus a dermal melasma. Then you can do 1, maybe 2 IPLs to just get rid of the epidermal melasma, but you're still not treating the cause. You're only treating the symptom. And then that heat
can exacerbate the melasma.
Exactly. And so this is where that balance comes into play. And finally, we have something that may have the opportunity to actually reverse the cause of melasma, which is exciting for me to really, really see.
Yeah, and the other thing is that when you're putting hot little needles in the tissue, you are shutting down a lot of little microcapillary flow. And a lot of melasma has a vascular component to it. So if you kind of reduce the vascularity that's going to it, it's a double whammy. You're improving it both ways.
Yep. So we'll get into, now we're getting into the
oh gosh.
It's going to be
here, we went totally off on the
tube. Will this record? I think it will
This is going to be on YouTube.
This goes on our YouTube
This will be on YouTube
so
in a week.
Let everybody know we do have a YouTube channel. But melasma, probably a PW2. If you guys are a pulse wave 2, probably 0.5 millimeter, 0.05 millimeters into there at a low setting, like a 4 or 5 joules is probably where we
I wouldn't treat melasma with any other RF device because the technology is not the same.
No, secret RF is not the insulated. Nope. If you have no, you can't even do it with the Scarlet. The Scarlet is the generation 1 of Silpherm, but Silpherm is the only one on the marketplace that has the pulse wave. Yeah. And it's because of the pulse wave we're able to get that treatment. So if you guys are interested in getting a Silpherm, let them know that Aesthetic Immersion talk to you guys about it, and they should be able to get you a discount, hopefully. Let them know Lori and Dr. Kwok told you, and hopefully you'll be able to squeeze out a few $1,000s extra off of your machine. Yeah. If you guys are interested in the exosomes, they did give us a code for Benev. It's EXO hyphen XPERT expert. Expert. If you have questions about it, email us. Learn at theaestheticidimmersion.com or just DM us, and then we can get you those codes to get you a discount on some of the Silpherm tips as well as the exosomes, if you guys are interested in that, because these are things that we all use. I love using the exosomes. I think it's part of my burn protocols if we burn patients and all that stuff. But just when we put it on CO2 lasers, when we put it on after making RFs, by the time they walk out, that redness is probably like 70-80% gone. Like I get a microneedling RF and it's gone.
Can I share with you something that I prep all of my patients with before I do procedures? Sure. I love Elastin. It's probably the skincare product that has the most research about it than any other skincare product. And they have something called Nectar, and it will go in and clear out the extracellular matrix, get all the old fibroblasts and collagen out of there, and it will let you build new collagen. So I always prep my patients 2 weeks before when I do Silpherm, when I do microneedling, when I do CO2s, even when I do Sculptra. I will prep them a couple weeks before with the Nectar. Yeah. So it preps their tissue so that when I do stimulate their collagen, they're going to get even a better, more appropriate stimulation of collagen and fibroblasts than they would have gotten. So it's going to help the procedure look even better. and if as far as our outcome. So I throw that into the package. I just make a package price and I put that into the package. So that's one other thing that can help your outcomes be looking even shinier and bigger and brighter and better. That's easy to do.
Yep, for sure.
Yeah.
What other questions do we have, guys?
Just gosh, we totally went off the deep end.
We went on the deep end.
Okay, so we got to mechanical. We've talked about radio frequency. We'll go forward. We've talked. We have a little PowerPoint here, but we just went off the deep end.
Okay, we talked about microneedling. Okay, you guys got that. So let's see. Microneedling the goods, non-invasive, economical. It really doesn't hurt. You numb them up. Really doesn't hurt. It creates the nice channels as long as you're using the good one. The one that we both use is Skin Pen. I love it because it is wireless. There's no cord to it, and it's easy to use and stuff like that. Back up and forth. Let's see. Microneedling the bad. Results are slower, of course. You definitely need to do a couple of treatments. It's probably 5 treatments, as I said. Yeah. If you're going to start with one, it's not even worth it to really do it unless it's more for maintenance on that aspect of it.
And they're more jacked up for a few days.
They are.
They're just like 2 or 3 days are kind of pink and jacked up. Whereas if you're doing the radio frequency, like if you use exosomes, 3 hours,
they're causing 3 million little holes in your face. So they're going to definitely do that. You know, I definitely do a lighter one on myself with the exosomes, and I just look a little kind of glowy the next day. It's like I got a nice tan, actually, which I kind of like. So that's kind of what I would definitely say with the bads with regards to it. The uglies: prolonged swelling, redness, flaky skin, infection, and scarring if not done properly, and you're dragging and you're using not a great pen. You could definitely do infections, definitely making sure you have one that actually is cleanable or safe. They have the little sleeves on the Skin Pen, which I like if you're going to get aggressive on the aspect of it, so you can the safety comes in with regards to that.
And I was going to talk about the ugly. I had a patient that came to me and she had microneedling done by, she thought it was an esthetician, which in California it wouldn't be legal. And they went so much on her cheek, they just went around and around and around that it abraded and it just took off the entire epidermis. And she hyperpigmented in that entire area. So
they broke the basement membrane.
You don't want to get too deep. You don't want to go. You don't need to do that.
Exactly. You don't need to go. I see this all the time. People get aggressive. Like, I need to see blood.
Yeah, no.
It's like they need to be a vampire and like pull the blood out of their faces before they feel like they got a great treatment. And you guys don't need to do that. You have to understand why you're doing it. What layer of tissue are you affecting with regards to that? So, understand if you're just doing it for just general improvement in texture, tone, between 0.5 millimeter, 1 millimeter should be enough. You don't need to go that deep. If you're trying to get deeper to get more tightening, then you might as well just move over to microneedling RF. It's going to get you a better result with regards to that.
With less damage.
With less damage in that sense. If you have acne scars, that's appropriate. If you have a scar or something like that, maybe even dealing with your those stretch marks and stuff like that, that is appropriate to get down deeper and aggressive into those areas because there's a purpose for that. So think about what you're doing and why you're doing it for your patients. Don't just prescribe, I'm just going to do 2.0 just on the patient just because, and I want to pull out as much blood and make them bloody so they feel like they got a good treatment. Well, you may be giving them actually a bad treatment,
a subpar,
and it really, really actually causing more damage than good.
Yeah, I think that's very, very true. We need to be really we want you to use your critical thinking and think about what you're doing. Think about if there's a lot of blood coming out, how am I going to get the PRP or exosomes in? How am I going to do that? You're not. So we, like Gideon said, we don't want a lot of bleeding with that. Somebody asked here, can we incorporate filler with radiofrequency microneedling? I generally don't. Do you? The same day? You can, but you have
to understand what level of tissue are you addressing. This is I get these questions, especially since I do threads a lot, and I get the questions with threads, can you do this, can you do that? I'm like, if you understand what layer of tissue are you placing it, where are you placing your tissue, where are you placing your filler, where are you placing your threads, how deep are you going with your microneedling RF? Are you at that level? that you're going to actually interact with it.
Better not be.
Secondarily, filler realize they go through a sterilization process at 150 degrees Celsius for at least half an hour to 45 minutes before they actually are packaged and given to you. So you think how much energy your RF, especially microneedling RF, energy is really given at one specific time.
Yeah, I wasn't so much thinking of the heat with it. I was just thinking of, like, generally fillers, we're putting it in the deep fat pad anyway.
Exactly.
What I was thinking of was pressing on it. I kind of wanted to sit there for a couple weeks, let it just kind of settle in before I'm pressing on it. That was the only thing. Would it hurt it? Probably not. You know, we're going to be putting, like, mid-face, you're in between the ZCL and the oral anyway, so it's going to kind of be sitting there. But
yes,
so,
that is something to think about. You may be pressing on it if you're aggressive with your stamping. You may be a little bit more aggressive. Maybe do it in a couple weeks after, or do it before. I think once it's just things have settled down, I try to tell my patients, let's do it things every 4 weeks type of a thing.
Yeah.
You let everything settle down so they don't think that if there happens to be some kind of adverse event that, oh, it's because you mix the two or anything like that. You know, I do get patients from out of town, and so I have to do everything kind of at one time. I will do it all at one time just because I know they're working on different levels of tissue. You can do fillers, you can do threads, you can do toxins. You know, all of that can be done all at one time if you really think about what level of tissue are you affecting.
What layer are you in? Exactly.
Let's see. Are you microneedling exosomes in the skin, or is it placed? Oh, I'm using it to microneedle into it.
For regular microneedling. For RF, I don't.
Yes, for microneedling RF, I place it afterwards. For CO2s, afterwards.
But don't put that on your social media. Yeah. Just saying. If you're injecting it, or if you're somehow putting it into the tissue, don't advertise that, because that's the FDA.
You just don't want FDA to just say, "Oh, you're using it in this way." You know, just
put on top.
You can talk about it as we're doing topical exosomes with our microneedling.
There you go.
Just generalize it. Radio frequency microneedling overview. You know, it's a machine device. It uses a little bit bigger needles, and it's used to transmit the radio frequency energy into the deeper tissues. You get thermal coagulation, which will force some denaturization, and of course stimulate better collagen into the area. Devices: so for Max, Morpheus, Vivace, Virtue, Secret, Potenza. What else is out there?
Profound, Fractora,
Genius, I think.
There's all kinds of brands.
There's so many different brands out there. And so it's not that it's a bad thing. You just need to understand your machine and how you're doing it. If you already have committed to it. We both have played with Vivace. My clinics have Virtues at certain ones, and then
I've had Fractora, I've had Profound, I've had
the newest ones, still firms we definitely like on that aspect of it. So
now keep in mind one thing: when you're doing radiofrequency microneedling, there's almost no reason to go deeper than 2 millimeters, maybe 2.5. Yes. If you go deeper than that, you're hitting fat. And we have had so many patients come into us to have either fillers or biostimulants or biologics put in, because it's usually the Morpheus, and I hate to say that, but I'm not sure why people are going.
More popular.
Maybe because they're using that.
Marketed
they're going deeper and hotter and burning fat, and the faces are thinning. They're thinning down. Yep. So be really aware, no matter what you're using. Be very aware of that dermal thickness. Be very, no matter what you're using. You don't want to get like you say.
The challenge to you guys
it's the steak.
Understand what you guys are doing.
It's the steak.
Yeah.
Do you want a well done charred burned steak, or do you want a nice medium steak? Well, the medium one's really good, and that's kind of like the others. But if you go too hot, too deep, too much, you're going way over what you need to do, and causing more damage than what you need to do. So you just need to get enough denaturization of that collagen to get more collagen production. That's all we got to do.
Yeah, I mean that is the whole thing out there. I think majority of you guys, when you guys are buying a laser or some kind of device, make sure that you guys understand what your purpose is. I think a lot of people get into the fact they're sold by their salesperson, and then the trainer comes in. And realize when trainers come in to train, their job is to get you trained on how to use the machine. They're not trained to get you the results. Okay, they're trained on you to use the machine. Just like when we train for Galderma or MERS or any of these companies, our job is to get you trained on the product, that you understand how the product works, how to inject it up to a certain point. We're not there to teach you on how to get amazing, beautiful results. That's for you guys to get educated on. Okay, so you guys need to take your education seriously and understand free education is great, but really looking for it and really doing your own education, paying for more education, going to conferences, going and finding somebody in your area that you can say, hey, can I shadow you? I think you do good work. Or flying somewhere, shadowing somebody, having them do a private training for somebody you think in your area or wherever in the world that you think does a great job, and learning the understanding and asking them why they're doing it. How do they get their results? Why are they doing it this way? Why are they doing it that way? Because you need to understand why you're doing things. And I think that's the biggest thing. Morpheus 8 is not a bad machine. I had the previous version of it, which was called Fractora. It hurt like a mother, but ultimately what happened is they marketed themselves as something that was going to, we can go deeper because we can push it and push it. Well, realizing practitioners did not realize it, that your skin is only so thin. You go beyond the layer of skin, what are you going to hit? Fat. And so you're going to put heat into fat. What is going to happen? You're going to kill fat. And I'm seeing it. I'm seeing my certain patients coming to see me and like, look, my neck looks worse than it is. I have like an 80-year-old neck and I had a beautiful look before. And they're starting to get slightly depressed. And it's because people out there are not understanding why they're doing things. They're just going, oh, well, this is the setting that the company gave me, and I'm just going to go at it without understanding why. Now, there is a purpose on certain times where you want to kill some fat. There's hypertrophying of fat in this area. There's fat in this area, so going deep is fine. But you guys really need to take into consideration of what you are doing and why you are doing it. Think about it critically instead of just following what another person said or what that person said. If it doesn't make sense to you or you're starting to question, I didn't realize, ask somebody around you why they're doing certain things. You know, because you have to go out there and figure out. The education in this field is all over the place, unfortunately. You're going to make some mistakes along the way, but hopefully you're investing in getting good education on that aspect of it. Okay. Last question. Do you think rubbing PRP on the face during microneedling works? Depends on how aggressively you did your microneedling, I think. Vera.
During microneedling, yeah, probably helps some of it probably get in those channels.
Yeah, if you can get it, if it's light enough that blood's not coming out, PRP can work. I'm not dousing to PRP. I'm just saying you guys need to understand PRP and its job and its functionality. Yeah,
I think that would be great.
All right. I think time's up.
I know.
Our team is going, we need to wrap it up because we need to prepare for our mentorship call that's coming up. But hopefully that was a insightful little
conversation
that went in a different direction than all of us.
Yeah, thank you for all your questions. We appreciate that because it helps us just kind of connect with you and answer what's on your mind. Thank you.
But if you guys have any questions, DM her, as I said. DM the Aesthetic Immersion. Learn at theaestheticimmersion.com.
Dr. Guns and Needles. DM him.
But ultimately, thanks for joining us. We will see you next week or next month. April 4th. The topic that we have chosen
is a surprise.
It's a surprise. No, we could talk about it.
Really?
I think it's important.
Okay.
I think where did the art go? We're going to talk about the artistry of this field and where it went.
Artistry of anatomy.
Artistry of what we do in this field. So hopefully we'll catch you guys next week. But thank you guys. We'll see you next month.
Thanks for joining.
Bye-bye.